Hi, this video blog is for Infm 645. The blog is about, I'll just read the question. It's about imagining that you're a patient having a non-invasive procedure at an academy medical center. The attending physician tells you that it is common to allow residents and fellows to perform the procedures while they are attending, as the attending simply instructs. Do I feel comfortable allowing the residents fellow to perform the procedure, or opposed to the attending physician who has 25 years of experience performing the procedure? If I'm not comfortable with allowing the resident or the fellow to perform the procedure, and will make it clear and well known to the attending physician, and they proceed to still tell me that it is a teaching medical facility, and the resident or the fellow will still be performing the procedure despite my feelings, would this be considered a legal issue for the medical facility? If so, what category would this fall under legally? So first of all, I would allow the fellow or the resident to perform the procedure because it is a non-invasive procedure. Non-invasive procedure is a conservative treatment that does not require an incision in the body or the removal of a tissue. So yes, I will allow a resident or a fellow to examine me, to perform vital signs on me, to simply give me immunization, to actually see me before the attending physician come in and conclude what my visit is. Another thing is, if I didn't agree to that, I already should know that it was a teaching and training facility. It says, the name says it, attending physician with the experience already instructed me that. So I shouldn't try to be suing them or think that it will be some kind of legal issue, because I was already warned. They told me, I knew it was a teaching hospital. There's a possibility that I will be seen by a resident or a fellow. So there should not be any legal action with that. Now it's up to me to say, well, I'm gonna stay there and be seen by a resident, or I can just leave and go to another facility. I've had several examples where I've been treated by a resident or a fellow, and my kids actually have been treated by a fellow or a resident. One scenario I had was when I went to the doctor's office, and the resident came in with the physician into the room, and the physician told me who the resident was, and that he was actually going to watch what was going on today, what he was going to do today. He didn't actually do anything, but he later came in and checked my blood pressure again. So that was something that I would allow because it's non-invasive. I also had another example was with my kids, where the resident was actually following the doctor that day around into the rooms. The doctor let me know that he was a fellow resident and that he will be observing what he was doing. And the resident was actually the one that gave my kids their shots that day, which I didn't see an issue with it because I was already warned, and I knew that he was there to train, so which is allowed. In comparing, I will compare it to just like when the medical assistants go into doctor's offices and have like their externship or internship. I would compare it to that. You know, it's something sort of like that. But now we're talking about a situation where it is actually a teaching hospital. We already know, the name gave it up, that it's already a teaching hospital or training hospital. So there is a possibility that a fellow will be performing some type of non-invasive procedure on you. and the fact that you were already told by the attendee who has the experience, and I'm very sure if there was any error that would be happening because he was going to be in the room, it would be corrected immediately because he was there. So I don't see any risk or any issue with having a resident perform a non-invasive procedure on me. Thank you, and that concludes my vlog for today. Thanks. Bye bye.